Hello, everyone. I'm Sheldon Baker, the host of Healthy Bytes. My guest today is Dr. Lisa Zimmermann. She is a functional and regenerative medicine specialist and founder of Zimmerman Modern Wellness in New Jersey. Dr. Zimmerman specializes in chronic Lyme, mold illness, preventative cardiovascular health, gut health, and bioidentical hormones. Lyme disease, which is caused by the bacterium Borrelia burgdorferi and is transmitted via a tick bite. Only a small percentage of those infected will develop the bullseye rash. At ZMW, Dr. Zimmerman specializes in diagnosing and treating chronic Lyme. The clinic maintains the most advanced labs and treatment options available for Lyme disease. Dr. Zimmerman has created an extensive repertoire of treatment of options through several decades of intensive research, training, and clinical practice. Her goal and that of ZMW is to create a personalized protocol for optimal health and longevity, offering a revolutionary approach to wellness. Dr. Zimmerman, thank you for joining me today on Healthy Bytes.
You're welcome.
Now,
Glad to be here.
Thank you. You kind of changed your career due to an illness with one of your daughters.
That's correct. I was an internal medicine doctor for about probably 10 years. My daughter got very sick with a mysterious illness. No one could diagnose it. I felt it was probably tick-borne because she had been to summer camp, but we couldn't diagnose it. Finally, when we got the diagnosis, she had been pretty sick for 6 months, and it took us another 2.5 years to get her back to a healthy state. So that led me on the whole search of who could help her, and when they didn't help her completely, I went on my own quest to see what I could do to get her healthy. So she was patient zero, as she likes to say. And then after that, I'm like, I might as well special in tick-borne disease. I knew so much. That started it.
So why is Lyme disease diagnosis missed in both patients with both acute presentation and chronic symptoms? And what tests have you found to be the most accurate?
Right. So usually when people present with an acute bullseye rash from Lyme, we kind of get that big message, I got bitten by a tick. But 40% of tick bites do not transmit a bullseye rash, despite you getting Lyme disease. So you don't feel anything, you don't feel sick for 3 or 4 weeks after the tick bite. Then if someone thinks about it, you're flu-like and you have this mysterious set of symptoms to test for Lyme, they send you to LabCorp to get a Lyme titer. Now, a Lyme titer is only positive for 10 days after the tick bite. Took you 3 to 4 weeks to feel sick, so you're not being tested till at least 4 weeks later, and the titer's already negative. So now an uninformed physician says, oh, the titer's negative, you don't have Lyme. So the next step would be to do a Western blot antibody test at a conventional lab, looking, did you make antibodies to Lyme disease? Now that's also fraught with misconceptions, where in the 1970s they came up with a criteria that you need 5 bands positive of these antibodies to the proteins from the Lyme disease bug. We now know you don't need 5 bands to say you're positive, but the doctors haven't updated to the new criteria. Plus, the problem is they're testing you for Borrelia burgdorferi. There's now 16 different subspecies of Lyme disease. So maybe you didn't get Borrelia burgdorferi. Maybe you contracted Borrelia azaphili. We're not testing for that at the standard labs. So again, you're told you don't have Lyme disease and you have persistent disabling symptoms. So, I've gone with a lot of more advanced lab testing that includes 16 different subspecies of Lyme disease, as well as co-infections, and they really have a better sensitivity at picking up low levels of antibodies, so we can properly diagnose the patient.
Can a tick bite occur through clothing?
Not usually, not through clothing, but they'll crawl right up underneath your pant leg, and they're minuscule. You don't see them. They can bite you, say the back of your knee, drink a little blood, fall off 6 hours later, you never saw them. They don't make a rash, you don't feel sick. Nobody thinks of it 2 months later when you present with a flu-like illness.
So
And
what
then
I,
it persists.
so what I guess you're saying is a person wouldn't know if they've been infected by a tick bite.
Right. So only 40% of tick bites get that characteristic rash. 60% of us get a tick bite and we never knew it. And that's common. I'd say 80% of my patients never had a rash.
Is there a favorite place on a person's body that a tick will be attracted
Well, it
to?
likes really warm areas, so it'll crawl up into the groin, under the arms, any spot that's a little warmer in your skin. So it'll find those places usually. But it could be on your back and you never see it.
So the trick is to stay cold. I'm just joking.
Yeah, well, go in the winter if you want to hike when it's 0 degrees out, right?
Okay. So can someone be treated for a few weeks with antibiotics, yet the symptoms do not clear or even
Right.
return soon after treatment is finished?
Right. So Lyme disease is it's a bacteria. Now there's different types of bacteria, and we're going to qualify it as a spirochete. So spirochetes create 3 forms in the body. They have the free-floating ones that are floating in the bloodstream, and within 6 hours of getting bitten, they're going to start walling themselves off into a cystic form. They're also going to cover themselves up with biofilm. They're very smart. So if I give you some antibiotics, it can't get through the biofilm. So it's not going to get the ones that are underneath the biofilm. It's not going to get the ones that are in a cystic capsule. It'll get the ones that are floating around in the bloodstream and in the joint fluid. So you're going to feel a bit better. You'll complete your couple of weeks of antibiotics. And 2 months later, more are going to come spitting out from under the biofilm or come out of these cystic capsules, and you're sick again. So you have to really have a treatment plan that's going to break up the cyst capsule, break up the biofilm, and use either antibiotics or herbs. Now, when you treat a bacteria, you double the time of treatment to their life cycle. So if you get a strep throat infection, the life cycle of strep bacteria is 5 days. Hence, they say take 10 days of antibiotic, double that length, you should get them all. Spirochetes live for 9 months. Hence, you're supposed to treat for 18 months continuously with something for biofilm, with something to break up the cysts. Now, no one is going to take antibiotics for 18 months, right? So I use a lot of herbal medicine because herbs you could take for a year. It's going to get at all of the different forms and it's not going to disrupt your gut, right? Otherwise, you're going to strip your gut of all your good bacteria. So maybe the course of treatment is too short. Maybe you didn't get the biofilm. Maybe you didn't get them out of the cysts. And how many are there? If you've had Lyme disease for 2 months, not too many. If you've been sick for a year, you have a lot. A lot of bacteria.
So I think what you're saying, antibiotics are not the only answer. It is not the only answer. Yeah.
Right, and they've gotten a lot of protocols where you rotate the antibiotics, you change them, you get cyst-busting antibiotics, but I haven't seen a patient that can make it past 4 months of antibiotics without getting diarrhea and all types of gastric symptoms, so they stop. And they feel a bit better, but then a year later it might come back.
There's also the issue of overlooked co-infections. How may that change treatment and recovery?
Yes, it definitely changes treatment. So if someone tests you for Lyme disease and they don't, the tick is basically a cesspool. It's a reservoir of infections. So you can have Babesia, which is a parasite You can have Bartonella, which is another bacterial infection, ehrlichiosis, anaplasma. They're all in the tick. So you might have Lyme disease plus Bartonella. So if I only treat you for Lyme, there's a whole different treatment protocol for Bartonella. So you don't get all better. And that's because they missed one of the infections.
So help our viewers understand how immune system dysfunction can play a big role in preventing a patient from clearing the Lyme infection and keeping it in remission.
Right. So when we get an infection, the first thing we have is our T cells. It's part of the immune system that's ready to go to fight off the infection. So it's what we call killer T cells. They run in and they're trying to clear the infection. If the infection has been there for quite some time, you're going to outpace your ability to make them. In other words, you're going to use them up quicker than you can make them. So if you have a really low T cell lymphocyte count, your body's already not able to kill it off as well as it should. Next thing is antibodies or B cells. They could also get deficient and unable to make a high enough antibody count to kill them off. So now if I'm using antibiotics or herbs and your immune system is not helping me, it's going to be more difficult. Right, so I do T cell counts, B cell counts, and look at where we are. And we try to use things that modulate your immune system as well. I might use ozone therapy, it's used in Europe a lot, to get your immune system healthier.
And you may have touched on this earlier. What are the most advanced treatments available to cure persistent Lyme and other tick-borne infections?
Right. So if you go to the International Lyme Association, they're going to give you rotating antibiotics. I did that in the beginning, but again, I have to do 9 months of rotating antibiotics. Nobody made it through the protocol. And I was disappointed with that, so I started doing herbal medicine. And those work very well, but I found the best protocol is combining ozone therapy to modulate your immune system. And now we have a new treatment available for the last 5 years in the US called SOT, which is single oligonucleotide treatment. And you're like, what is that? So Lyme disease or bacteria are made of proteins. Those proteins are called nucleotides. So I'll take your blood sample, I'll ship it to a lab in Greece. That's going to get the genetic sequence of your nucleotides that make up your Lyme disease bug. Then they're going to design a nucleotide on a machine, a synthetic protein that's going to fit right into the genome of your Lyme disease bug. They're going to ship me back these little proteins in a vial. I'm going to give it to you intravenously. They're going to run around and insert themselves into the Lyme disease bacteria bugs and disable them and kill them. So if I have 1,000 little nucleotide proteins, it'll kill 1,000 Lyme disease bugs per day, no matter where they are, whether they're in the cystic capsules, under the biofilm, hiding in your liver, they're going to genetically seek them out. Those proteins with one infusion is going to be in your body for 5 months. So in 5 months, I could kill off a lot of spirochetes, a lot of Borrelia, and 80% of people, I give them that one dose and it's all eradicated. 20% of people might have so many, I might need to get a second dose. So that's dramatically changed for a lot of my chronic Lyme disease patients, and they could do it for Bartonella and babesiosis and all the co-infections. So that's changed things.
So at the end of the day, your advice would be don't get bitten by a tick.
Right. Well, I also think that there's a subset of us that have genetic genes that we don't clear the Lyme disease well. There are some of us that get bitten and we never get sick. Our immune system is quite good at getting in, getting rid of them or walling them off and staying them in a dormant state. So that's why some people get bitten. They don't even know they got bitten and they never get sick.
Dr. Zimmerman, I appreciate you being here today telling us about Lyme disease. Hope to have you back again real soon.
That'd be my pleasure.
All right, and thanks to all of you for watching Healthy Bites.
Thank you for having me here.